about 1.1 million people living with HIV in the US, which is about 1 in 300 people. In Houston, we think it's around 25,000 people with HIV. And a sizable number of those people are unaware. Best estimate is about 15% of people living with HIV are infected but not yet aware of that because they haven't had an HIV test. Basically, anyone is at risk for HIV. Anyone who's had sex and anyone who certainly has injected drugs. The highest risk are men who have sex with men, but it doesn't. You can be in any risk category and still become positive. It doesn't require you have a lot of partners. It doesn't require that you be necessarily promiscuous. It just requires one person for you to become positive. So the only way to really know is to have a test. Basically, any adult and adolescent should be tested for HIV. You really can't tell if you're infected until you have a test. Like a lot of conditions, a lot of cancers and things like that, the earlier you're diagnosed, the better your chances of living long and healthy with it are. So with HIV, we know that you want to be tested and diagnosed as early as possible because the treatment that you can get on actually helps you live longer. You have to get a test to know that you're negative. And if you think you're at increased risk, there are a lot of tools out there that can be used to try to keep you negative. There are prevention medicines that can be used. There's obviously prevention behaviors that can be used, and you need to ask your doctor about those things. This month, Magic Johnson celebrated 25 years of living with HIV, and so we have patients over in our clinics that have lived decades with HIV, but the key to it is knowing that they're positive so that they can get on treatment. There are plenty of places you can go specifically for an HIV test. There are a lot of places that offer free HIV testing, but one of the easiest ways to do it is the next time you're going to see your doctor, whether it's your primary care provider, your OB/GYN, whoever it is, just ask them for an HIV test. It's covered by most insurances, it's very low cost, and it's a very, very good test. If you know you're infected, you can take measures to improve your own health, right? You can get on medicine, which can not only help you live a long, healthy life, but also there's a benefit to your partners, your loved ones. They can now, because you can get on medicine and drive the amount of HIV in your body down to very low levels, it makes you far less likely to give HIV to someone else. So it's important for your own health, but it's also a way to protect your loved ones. Again, if you have HIV, if you think you might have HIV, know your status, and then with proper planning and medical care, you can have children, you can lead a long, healthy life.